Hi, everyone, and welcome to this masterclass on health insurance and diabetes. Today, I'm going to talk about some concepts in insurance, and the number one question that I always get asked from people who have children or they themselves were newly diagnosed with diabetes or a chronic condition. That question is, what is the best insurance, best health insurance to get after a diabetes diagnosis? So I'm going to share my screen here very quickly so that you can all see my presentation. Be very, promise brief and not too many words on the screen, but just some cues to help me go through here and talk about this. Before I begin, can you all hear me okay? Give me a thumbs up if you can, or give me a no if you can't. Great, thank you so much. So, health insurance and diabetes. I will answer what is the best one to get after a diabetes diagnosis. But first, I want to talk about what we're going to cover today in addition to that. Understanding what your coverage needs are when you have diabetes, and understanding how to elevate health insurance options. There might be a lot of options out there, or there might not be. And when I talk about options, I'm talking about this in the sense of commercial insurance. I live in Dubai in the United Arab Emirates, and here there is commercial insurance. There is not a social insurance system structure, nor is it really exactly structured like the US is now. So some of these concepts might help you if you are in the US and understanding how basic insurance works or should work, but this is not really geared toward a discussion of environments where there's social insurance, where everything is automatically covered no matter what, no matter where you are. For those of us that live in countries where there's a private insurance sector and we have to pick and choose and buy our health insurance, then sometimes things can get tricky or leave us with a lot more questions than answers, or sometimes more questions than coverage. So that's who really I made this for. And when I talk about evaluating health options, that's kind of what we're going to get into. And also how you might effectively communicate with your health insurance company. That I think is really important. And sometimes when you need to escalate things, especially, you need to understand where to go, what you can do, and how to do that. So I'll touch on that a little bit. Please, if you have questions, I put a Q&A session at the end, because I will not, this call will be recorded, but I will not record the part with the questions because some of those might be really personal. And that's maybe your health information or personal information that you're going to share, and we will not be sharing that. Also, please note that this is not medical advice. This is not telling you necessarily one insurance is better or the other. It's just what to understand about insurance, key terms and processes. If you need medical advice about your diabetes or other chronic condition, please go ask a qualified doctor. So, who is this for? As I mentioned, people who have diabetes or another chronic condition, parents and caretakers who are new to insurance, or maybe you're new to managing diabetes in a child and you're finding diabetes is very expensive and how can I get this covered? You work in a doctor's office or clinic and maybe you want to better understand some of the challenges that your patients face. You might be really crystal clear on the challenges you face as a doctor or working in a clinic or a hospital, but sometimes looking at it from the patient side, from your patient side, can be helpful. And maybe you want better insurance coverage, but you're not sure where to start. Could be that you already do have health insurance, but it's not covering anything. So how can you change that and move forward? What should you do? And maybe you're just plain sick and tired of fighting with your health insurance to cover your diabetes care and supplies. I know it can be really frustrating. So who am I to talk about insurance? Just a little bit about me. For those of you that don't know me, my name is Pam Durant. I am the founder and managing director of Diapoint. I'm a certified health and wellness and lifestyle medicine coach. And I'm also certified in some other things like mindful eating as well. Most recently, I have a nutrition certification from Harvard Medical School, making sustainable nutrition plans, a member of the Institute of Coaching, and been certified by the American College of Lifestyle Medicine. My first coaching class was done with well coaches in the US, who I really appreciate because they're really trying to elevate the profession and create there's a board exam that right now is optional to take if you are a coach in the US, but eventually that will probably become the gold standard because there's a lot of people out there doing coaching or saying they're coaches. And like anyone that's supporting you in your health and wellness, you want to make sure that there's a certain standard that people are following. It's a real honor to do this work. And before I became a coach and went down this path, I was working in healthcare in hospitals. I was a hospital manager working in strategy and quality management. And as I mentioned, I know how challenging insurance can be because I've had my own personal experiences just for myself as a person. But my son was diagnosed with type 1 diabetes when he was just 18 months old. And that has brought some insurance challenges and lessons over the years that I'm going to share with you through this discussion today. I have over 30 years of healthcare experience, and I've also worked in an insurance company as well. That was my first professional healthcare job. So thankfully, that taught me a lot. That has really helped me throughout the years. So the impact of a diabetes diagnosis, I think if you've joined this call, you know that it's challenging. You know that there are certain lifestyle changes. If you're managing a child with type 1 diabetes, you know that did not have anything to do with your lifestyle or your child's lifestyle, or if you're a mom, anything you did when you were pregnant or anything like that. It is not about your lifestyle. But lifestyle can be affected by type 1 diabetes. Type 2 diabetes sometimes requires us to look at our lifestyle and see what we can do better. And if we're all focused on a healthy lifestyle, we'll have better outcomes no matter what type of diabetes it is that we're managing. There's dietary adjustments, there's carb counting, there's monitoring blood sugar, and a whole lot of other things. These changes can impact what you might need from your insurance and sometimes your coverage. Not that they're going to support you if you said, hey, I'm eating healthy, I'm eating plant-based or these other things, but it can make a difference, or it can make it feel like it should make a difference. Maybe it will, maybe it won't. Healthcare expenses, doctor visits, medication, insulin, supplies, like medical equipment and disposables. And I'm going to talk a bit about what those are later. Understanding what this means financially and the expenses and what's covered and what's not under this pillar is super important. And then the impact of your chronic condition on your health insurance, whether it's a new insurance or one that you had already. So understanding how that impacts your coverage and what your insurance company will pay for and what they won't pay for is super important. So in answer to that one question that inspired me to do this session is, what is the best health insurance to have when you get diagnosed with diabetes? The best insurance to have is the one that you had when you were diagnosed. Let's say today you don't have diabetes and you have health insurance. That insurance is going to likely cover your diabetes under, of course, the contract that already exists with that. But it will not be defined as a pre-existing condition. What does that mean? A pre-existing condition is basically something that you had before that insurance policy started. It was existing before the date of the new insurance contract. It could be diabetes, asthma, heart disease, often something else chronic. Sometimes it's a surgery. Even if now we know here in the UAE, they often sell like separate maternity packages, but even if you were pregnant before you started a new insurance, your pregnancy is a pre-existing condition. And they're going to look at that very different than if you weren't pregnant before. And for females, they might make you have like an OB obstetric package that would cover all of your expenses should you become pregnant. But if you're pregnant before, it's a pre-existing condition, and they may look at it differently from a financial coverage perspective. than other things. Why is this important? Because once you have diabetes and you start looking for insurance, they might exclude certain things because people see diabetes, insurance companies see diabetes and they say, wow, expensive. And they may not want to cover as much as if you didn't have it. The premiums can become astronomical, very high. And I know when we've shopped for new insurance, when we weren't getting it through a company, and some of the quotes that came once they learned my son had diabetes, it was just for him to get coverage was extremely expensive, more than my husband and I both, and we don't really have any major things going on. And it just said to me that that was not the right insurance company for us, and they never really wanted to cover him anyway because they think it's very expensive. Sometimes there might be a waiting period. If you start with a new insurance company or a new contract, they might say, okay, we cover pre-existing conditions, but after you've been with us for 6 months or a year or something like that. So there may be a waiting period before they'll pay for anything. Even if they pay for medication, you might have to wait 6 months to get insulin because that relates to your diabetes, just as an example. And not everyone does that, but it can happen. And then sometimes, there is, if you work for a large multinational, those are also really great insurances to have because they often cover everything. And then you don't have this negotiation. You won't have waiting periods and some of these other things because you have a great HR team that is there to get the best benefits for their employees. So the things that health insurance companies do not often understand, they don't understand the different types of diabetes and what you need and what you don't need. Like, for example, once I had an insurance company that asked me to prove again that my son had type 1 diabetes so that they could make sure. We know that once you get a type 1 diabetes diagnosis, you have it for life. There's nothing you can do. And they had asked for proof of it. So I still had the early lab tests. I still have them for some reason from when he was diagnosed about 14 years ago. And I sent that to them and they said, no, can you please go get this test again? It's a little frustrating. In the end, I did not go get the test. I explained to them why that test was not needed again, and they didn't ask for the question. Not to mention, at that time, my son's age, the stress of getting another blood draw for another blood test is not really something that you want to do to a child. Not helpful. Often, medical equipment and disposables are not covered, and insurance companies don't understand why you need those as someone with diabetes, and they don't want to cover it. And it looks as though I'm not here to diss on people that work in insurance companies. I know some lovely people that work in insurance. I used to work in an health insurance company, but the system looks as though those things will not be covered, like your insulin pumps, your disposables that go with the pumps and things like that. It also looks as though insurance, the way that they price it, they look at an average cost, or maybe they look at a high-end cost when it comes to diabetes, and they look at all diabetes the same. They look at everyone with diabetes the same. What that means is that you might have well-managed diabetes, but you're going to get charged as if you don't have well-managed diabetes because they're expecting you to have a lot of complications and a lot of problems that they're going to have to pay for. So that's why the premium is higher. Even if you went and you proved you had amazing A1Cs and great time and range and all these other things that you're doing with your lifestyle, doesn't matter. They're like, diabetes, it's going to be this much. It is not rewarded. Allied health is super critical. By allied health, I mean those specialties that work with your endocrinologists and doctors. It can be like the diabetes educator, the nurses that support you. It could be a dietitian, the person that gives you education about carb counting and food and how to eat healthy that works with your doctor in the clinic. They are certified. That is not often covered by insurance. Podiatry is everything about the feet, or if you listen to our podcast on podiatry, everything from the waist down. And we know that is a very big need for people with diabetes. that they should be getting regular checkups with a podiatrist. Those are typically not covered. Psychology, coaching, other things, anything that is not typically the standard MD, go to your endocrinologist. Anything after that is often not covered. And we all know that it takes a village, takes a team of different medical and healthcare professionals to support you in your diabetes management, particularly when you're newly diagnosed, and sometimes you need these support services along the way. There is more than just the few that I've written there, but just to give you an idea and emphasize the fact that those are unfortunately not covered. I can say psychology is becoming more commonly covered, but it's usually like a limit, like 10 sessions or a certain amount of sessions. So just watch out for those. And if you have coverage, then that's great. So what should you do when you're looking for health insurance? What do you need to consider? You need to consider your coverage for diabetes care. So all the expenses, your doctor's visits, your medication, the equipment, those things that I just highlighted that are sometimes covered and sometimes not covered. You need to look for all of those. How much is it that you're going to have to pay out of your own pocket, including deductibles? By deductible, I mean that some insurances have it where you have to pay a certain amount before they start covering things. So I don't know, let's say $500 or 500 dirhams, whatever currency you tend to work with. Your deductible on something might be $500. So that means the first $500, you are going to pay that, and then your insurance company will cover everything after that. Copayment, kind of similar, but not. Copayment's usually like if you go to visit your doctor, your clinic, and for every doctor visit, sometimes you don't have to pay anything. Or you may go and for every doctor's appointment, maybe you have to pay, it's something very small, but $10, $20, or 50 dirhams. And you pay that whenever you go. But you're getting, a appointment with your doctor and other things that come with that, but they want you to pay that. That's what a copayment is. Co-insurance is when there is more than one insurance there and you need to look at the coverage. Maybe you're married and your spouse has a different insurance. So sometimes there's this thing, it's like a dance of called coordination of benefits. You might get some things covered under one policy that are not on the other, and vice versa. And sometimes the insurance companies can coordinate together, or you can coordinate together to get coverage from both sides. It just really depends on the environment, the legal environment, and the insurance companies. So you just want to, look at those things. Prescription drug coverage, super important if you're using insulin or anything. Of course, most insurance companies, they do cover prescriptions. Sometimes there is a deductible. You may have to pay the first 500 dirhams, for example, of your prescriptions, and then after that, your insurance will cover. Or the other thing they might do is there's a maximum amount, and after, say, 3,000 dirhams, that's all they cover. In 1 year, you cap out. If you need prescription drugs after 3,000 dirhams, let's say 3,500, you would pay the 500 dirhams. So you will pay anything after the maximum after you reach it. Inpatient versus outpatient coverage. So inpatient is if you're like staying in a hospital, if you have to stay overnight, that's the inpatient. Outpatient is that visit to the clinic. Sometimes you need both because you need follow-ups and different things like this. So you want to understand what are the costs and conditions for each of those. What's covered if you have to go into the hospital for a reason? Is everything included? Do you have a deductible? Are there any other costs that you have to pay for? If you have a child, do they cover for you to stay with that child? Different things like this. Now, excuse me, let me just get a quick drink of tea. And the network. So by provider, we mean the person that's providing you the healthcare service. So who is in your network? Who are the doctors that are in this insurance network? If they are in that network, that means that that insurance company has contracted with that doctor, hospital, or clinic for a certain amount of coverage. So sometimes it might be 100% for certain services. Sometimes it might be 80% or less. If they're not in your network, then you want to see if you can get reimbursed. So you would pay the cash or with your credit card to your doctor's office because they're not in the network. They'll give you a claim form, then you complete that claim form, and then you would send it to your insurance company after, and your insurance company will reimburse you by sending that to your bank account. So you just want to look and see what works. And maybe you already know which doctor you go to and what you prefer. And that could be, for some people, a big deciding factor on which healthcare facility or facilities that they want to see in their network. And it can affect the price as well. So as I mentioned, outpatient doctor visits, therapy visits, those are outpatients, things that don't require an overnight stay. Also, you want to check what kind of referrals you need. For example, let's say if psychology, the example I gave, psychology was covered, but some insurance companies might want a doctor's prescription for that. You can't just walk into a psychologist office. So maybe some offices, they have like a psychiatrist that they work with. A psychiatrist is an MD, they can prescribe, so they could write the referral and you can go there. It sometimes can be an admin hassle, but they want to make sure that, you know, there's no fraud, that you're legitimately in need of this service. And, you know, we all know there is such a need for mental health support when it comes to chronic conditions, but they still may ask for that referral. Are there diabetes experts covered on the plan? Talked about that a bit. You want to make sure that there are endocrinologists. If not your endocrinologist, check who else is there, and ask around if you have a network or a community of people that you can ask. Check to see what they think. Do they like them? Are they good? Do they follow up? Is the quality good? And how much, as I mentioned before, do you have to pay for the care outside of the network? Sometimes it might be 100% covered, almost not likely, but maybe 80%, or I've heard 60%, 50%, and that can get quite expensive. So that's something to consider when you're looking at the cost. Inpatient, those overnight things, as I mentioned, what's exactly covered? Will they cover medications prescribed in the hospital? Will they cover any disposables? Do they cover lab tests while you're in the hospital? All of those things. And like I said, if you have a child, do they cover for the parent to stay? And sometimes even if not a child, they might, you know, pay for someone to stay with you, a family member or something like this. That you want to check. A big one for people with diabetes, particularly, you know, if you're using an insulin pump. An insulin pump is considered medical equipment. A lot of insurance policies do not cover medical equipment, unfortunately, and we know that is very expensive. Glucose monitors are considered medical equipment. They're not super expensive, but you know, some of them are. And it's nice to have a good one that's covered. CGM, or continuous glucose monitors, the transmitter part of that is a piece of medical equipment. Medical equipment, you can typically use it again and again, more than once. So like my son uses a CGM, the transmitter on that is a piece of medical equipment. It's definitely not cheap. So if medical equipment is covered, it's amazing. Disposables. Disposables are things that are typically used one time, you throw them away. So there's a lot of disposables in healthcare, as we all know. And disposables might include needles to inject the insulin, pump insertion sites, because you put those on your body and you change them every few days. You need to throw them away and get a new insulin pods. That might be considered a disposable. CGM, the disposable part. So my son has a transmitter. So my son has a transmitter that he wears with his transmitter. He has a transmitter and he has a sensor, excuse me. The sensor is the part that is disposable. So that gets thrown away. So they typically have a one-time use, but you want to see if these are covered. Sometimes one may be covered and maybe not the other, or medical equipment. Again, it may have a deductible, it may be a percent. So how can you effectively communicate with your insurance company? It can be very difficult. So here in the UAE, a lot of them, they are now have apps where you can upload your documents and your different things. You can submit the claim through a website sometimes, but a lot of them are going to like app-based reimbursement things. So when you go and you put your information in there, you log in your bank account information so they can reimburse you if something's covered. So you submit it all through that website or the app. They may or may not approve it. And then if they don't, then you might be able to appeal it. I know some people, they've gone back to the broker. If you've dealt with an insurance broker that has sold you a health insurance, that broker probably doesn't know much about your health condition, doesn't know much about your coverage. After the sale, there's not really, in my experience, I've not gotten much support if there's been a challenge from a broker. So when a claim is denied, the first step is go back to the insurance company directly, either through their app or some other means or email, and you can, explain to them why this should be covered. It might be included in your, it might be a service included in your contract that maybe they denied for some reason or not, but you just want to make sure. Always go back, follow up. If it's wrongfully denied, then keep escalating it within the third-party administrator. So by third-party administrator, I mean every insurance company here, if it's a Bupa or some other company, name your big Allianz or whoever, name your big insurance company. They have what's called a third-party administrator who's like a middleman that's here in the country running their business, like making decisions of what's covered, what's denied on their behalf. There have been times where, for example, my son was due for a new insulin pump. At that time, my insurance covered medical devices. They denied his insurance. They denied his insulin pump, which according to the contract was incorrect. It should have been covered. I escalated it. They said no. So what I did actually, because at that time it was one of those big companies I mentioned, I picked up the phone and I called the customer service number of that company in another country. Now, that's not something I advise to do regularly because long distance calls can be expensive. It can be time consuming. You don't know what you're going to get. But if it's something that's really as big as a life-saving device like an insulin pump that you need every day of your life, then it is worth it to, one, follow up, and I don't want to use the word fight, let's say advocate for something that is contractually supposed to happen for you or your child or whoever it is. So that's one way that I've handled it. And I said, hey, do you know this has happened? And so then they followed up from their side. And in the end, it got covered. And I've done that with other things too. Sometimes, for example, things like mammograms or different diagnostic tests like that, they say, oh, they got to go get approval. So it might take like 2 weeks for this thing to get approved, maybe longer. And be sure in the case of a mammogram, if it's a routine mammogram, that's okay. But let's say you found a lump in your breast. Do you really want to sit around and wait for 2 weeks to see what it is? No. So to help expedite the process, I reach out to as many channels as possible to see what can happen if things are taking too long, because it shouldn't really take 2 weeks if, to approve something like that, especially if it has the potential to, affect your health in a negative way. You can, of course, also raise it to the local authorities. I do that as well. Here in the UAE, for example, the DHA has an email and I think maybe now a phone number that you can send feedback or complaints to. And I found them to be very responsive. They responded right away and they were really helpful for me in getting some things done. So that needed to be done that weren't covered. The other thing you can also do, ask your doctor to write additional evidence about why you need something. In the case of an insulin pump, it's a very expensive device. And if it seems to be that it's supposed to be covered, and if they have a doctor explaining to them why it should be covered and how it helps to improve healthcare outcomes and actually saves them money in the long term, then that's another thing that you can do to advocate for coverage.